Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today, I'm here with the founders of HeyRenee that 7 years ago also founded Heal, Dr. Renee Dua and Nick Desai. How are you both today?
Wonderful. How are you?
I'm doing well. I'm excited to talk with you more about your new company, and obviously a huge fan of Heal and very excited to learn more about the newest venture.
And great to talk about it on Slice of Healthcare with you.
Love it. Yeah, you and I, we've had a lot of conversations over the last couple months, so it's always great to have these type of conversations. My favorite, right? New companies where we're going to learn about kind of how you're operating, why you decided to even start the company, and also what you're exactly doing. So let's start out with really, why are you starting another health tech company?
Renee?
So, Nick and I had a great run at Heal, and now that the company is operating and we're hoping a wild success for Heal, we've been thinking a lot about some of the problems that we've set out to solve from the very beginning. And one that's been on my mind for years, and I'm excited to do something about it, is how patients manage to get done all the things us doctors ask them to do. Right? Every time I see a patient, I give that patient a list of 5 things to do, but who actually helps her get them done? Gets the doctor's appointments scheduled, the echo, the results, figures out that she needs help with her mental health. Who does those things for her, right? Not everybody has a caretaker or an available family member, or frankly, even knows what they need or how they need to be helped. And so I'm really excited to tackle that big problem with Nick.
And I love the name. Obviously, we're using your name for the company, and you and I were laughing a little bit about this before, but thankfully you have a nice name, or it would be really hard for for people to interact. Very cool. Love the why. Can you talk a little bit? I mean, whether it's Nick or you, Dr. Duo, that want to go into it, but talk us through how things are going to work with the platform a little bit?
Yeah. So look, managing your healthcare is hard. It's especially hard if you're one of the 100 million Americans that have 2 or more chronic disease: obesity, diabetes, hypertension, heart disease, mental health issues. And we want to make that easy because, as Renee said, you spend about 4 hours a year in a doctor's office and 8,750 hours a year outside of a doctor's office. And we want to be there for those hours to help you coordinate, communicate, and connect all aspects of your healthcare. And that's why we called it Hey Renee, because when Renee's mom or dad have a question about healthcare, they call her and say, hey, Renee, what am I supposed to do about this? Or I do, right? And everyone deserves that person, but not everyone's lucky enough to be married to or the parents of a doctor, so a caring, loving doctor, I should say. So we're creating a platform that would, for example, if your doctor said start taking benazepril for your blood pressure, it would make sure the benazepril gets to your house, then remind you to take it every day, then check your blood pressure, vital signs to make sure it's working for you. If your doctor says you need help with your mental health and you're a Spanish-speaking person who doesn't drive, we're going to get you set up with a therapist over video therapy who speaks Spanish, right? So it coordinates, communicates, and connects all aspects of the healthcare journey by matching your doctor's instructions to the available choices in your particular insurance plan.
I find that super interesting because I actually had, so my grandfather years ago was on dialysis and had, congestive heart failure, right? So he had every pill you could imagine, lots of doctor visits. And it was either one of his daughters, which one of them was previously a nurse, right, that always had to accompany him to the doctor's office because there was just so much information that the doctor would share. And I feel like anyone who goes through lots of doctor's visits, they probably understand maybe a little more than others because you hear it so much. But I don't know if he would have been able to handle everything if that extra 1 or 2 people wasn't there holding his hand along the way, right? And understanding what does he need to do from a pill perspective, from an exercise, from a diet, right? So the fact that you're helping with the steps that happen after you leave the doctor's office, I think is huge because that's where people's health can really go the opposite way, right? You're fine when you're at the doctor's office, but when you leave, are you going to follow their advice?
Yep. And I think that story, your dad, her dad, my dad, any of us who are getting older, anyone who suffers a chronic condition, it is hard to do all those things and it is hard to get them done. And we want to have that digital best friend, for lack of better words, that care champion who's there to remind you and make it easy to put all the pieces together and make them all work together so you actually do get better, right? The point of healthcare should not just be disease management, which means you're just getting sicker and more expensive, but actually helping you feel better and live your best life. And that's what we're trying to build with HeyRenee.
Yeah, and I think I'll just add to that Nick and I have a foundational view that your health insurance should be used proactively and preventively, right? Yeah. We do not want you to see a therapist because you are depressed. We bet that if you are diabetic and have some extra weight that you're carrying, you are overwhelmed by all the things you have to do. And therefore you do need mental health help. You do need remote monitoring of your vital signs, right? You do need medication reminders. And so we want to take the approach that you have, as Nick so aptly says, this digital best friend who's doing things behind the scenes, because you shouldn't have to remember all that stuff. It should just be a magical experience that helps you get it done.
And the last thing I'll add to that is that if it's hard for people like us and our parents, and thankfully we're educated and tech savvy and all of those things, it's incredibly hard for underprivileged, underserved Americans in rural areas, Americans who don't speak English as a first language, low health and tech literacy people who are left behind. 85% of the people who used telehealth in 2020 had a household income over $150,000 a year. That's not your average obese, diabetic, hypertensive patient in America. And we specifically are driven to serve those people because healthcare and great healthcare access is a fundamental human right.
Yeah, I find this super interesting. I'm really excited too for the launch and to see you two grow this just as you grew Heal. With that being said, I do want to shift focus a little bit into, you mentioned it earlier in the podcast, but you two are married, right? And I want to highlight and ask a question. So you started not one, but two of these like digital health companies. What's the secret sauce? How are you as spouses able to work well together and start a company like this? Because I think a lot of people want to maybe get into business with their spouse, but maybe they haven't found the right formula like you two have. And I think they'd be grateful to learn a little bit more.
Renee?
Well, so, I mean, I think there's a few different things. And to simplify, Nick is the CEO of our companies, but I'm the CEO of our house, right? And I think that's a really important line to draw. So that's number one. Number two, we're best friends. So we trust each other, right? There are things that Nick does that, I mean, he's so smart and I sometimes don't follow, but I have to trust. And that's a really important part of the background. And there are things that I know, for example, I'm a doctor. I don't want anyone else telling me how to practice medicine, right? So I want to be trusted. And I think those are some really important things that we've solved for in our working relationship.
Yeah, the thing I would say as a serial entrepreneur, and before starting Heal with Renee, I've had co-founders in different startups that were not my wife. And the thing that people don't understand sometimes, oh, well, what if you fight with your spouse or what if you argue? You're going to fight with your co-founder, right? And I always say this, in America, it's harder to get out of a company than it is with a partner than it is to get out of a marriage, right? And the point of that is that if you are a happily married couple and you have kids together as we do, and you know how to resolve conflict, right? We don't just have discussions or disagreements about Heal. We have 3 kids together. We have a house together. We travel together. So if you're already confident that as a team, you can solve conflicts together that are much higher stakes, our kids are much higher stakes to us than anything we'll do professionally, right? Then you can bring that to the workplace. Whereas sometimes co-founders are just 2 people who met at a co-working space and they've known each other for 20 minutes and they start a company. They're not necessarily going to have to been through high stress situations where they've had to work through conflict. So if you married your best friend, and I also married the smartest person I've ever met. So if you're lucky enough to do that, start a company with them, they're going to be your best friend and your best ally throughout the process.
Well, I think you two have really the best of both worlds too. Dr. Dura, you're a physician. Nick's an engineer by training. But I don't know if you knew this, but I thought he was a doctor. I used to call him Dr. Desai all the time. He's like, whoa, I'm actually not a doctor. I'm like, well, you kind of talk like a doctor. Yeah, and you understand. He's like, no, my wife's the doctor. So I'm sure I'm sure you've learned a lot from him over the years, and I'm sure he's learned a lot from you.
Yeah, absolutely. And it shows, right? I talk a lot about medicine. I talk about it at home. People ask me questions. And I mean, we've named an entire product after me because it's the joy of my life to talk about medicine and to help people, right? And I think Nick has this very articulate way of turning those thoughts into software. And so again, I mean, obviously you can listen to us for a few minutes and see that we admire each other and that we like each other very much. Of course, that's really important. But we also value those specific traits and tools that we each have separately that bring to life something we wouldn't have been able to do without each other.
But I also think that the unique chemistry is also that there's $15 billion have been invested in health tech just in the first half of this year, right? Some of those companies are started by doctors. Many of those companies are started by tech people, engineers, or people from the tech world. But how many of them have both at the founding level, right? And if we're going to solve or improve American healthcare with technology, it's going to take the perspective of a doctor, of tech people, and an undying and ultimate respect for our patients, right? And they're not co-founders, but they are co-founders, in that we're building a product for real everyday Americans to use in their daily lives to help them with big and little things to improve their health.
I'll tell you too, I love everything you're saying. And to me, it's not just what you say about one another and about the company. One of the reasons I really like doing these in a video setting is I get to see that little twinkle, that light in your eye, right? When you talk about one another and when you talk about, continuing to create a better healthcare, a better healthcare system in the United States, for one. And it really comes across by what you say, but it comes across even more. That's why if anyone's listening, also watch the video to this, because you can really see the look in both of your eyes.
Well, if you really want to see a twinkle in our eyes, get us talking about our kids,
right, yeah.
And we'll have a 3-hour podcast and we'll just be getting started.
But to your point, there are no Emmy winners here, right?
Yes.
This is
Genuine
sincere
passion.
and genuine excitement.
Yes.
I love it. Yeah. Oh, maybe we'll have to have the kid podcast at some point too.
Yeah.
What's harder, raising kids or running a startup, running multiple startups, right?
You know what? I will say raising kids, and I'll tell you why. Because I started a company and we did a lot of great things together at Heal. I've started companies before Heal. I've made mistakes, and you can always start another company. You don't get a start over on your kids, right? You got to do it right the first time, and you have no experience when you start.
And they remain unfunded or sometimes underfunded forever. Right?
Decades, yes.
You're always behind. Yes. You're always looking for capital.
Yes, indeed.
And you're not necessarily looking on a return on investment, right? You want them to be happy, have a good life, but there's no ROI attached to your kids, or hopefully not. Yeah. Right? Yeah.
Yes.
Well, it's Monday today, so both of us are in physical pain from our weekend.
Yes.
That's funny. Well, but before we wrap up, and thanks again, both of you, for being on the podcast, I want to end real quick with what's next for HeyRenee, and we'll wrap up after that.
Well, we're building an incredible team. If you want to join the team or learn more, please visit HeyRenee, that's spelled exactly how it sounds, HeyRenee.co, HeyRenee.co, to learn more. And we anticipate putting out the first version of our product in January 1 of 2022. And we're really excited. We're thrilled with the opportunity to be part of transforming a system to work for all Americans so everyone lives their best life.
Love it. I'm super excited to hear more announcements, and I'll throw that link in the show notes. People will be able to find out more about the company from there. But thank you both so much for being guests on the Slice of Healthcare podcast.
Thank you, Jared. This was wonderful. Thank you so much.